why is it important? Actually, tell me what the pap smear will test and why it's still important I still have my ovaries, but why it would be important for me to still have a pelvic exam.
The pelvic exam in your case, or for somebody that has had a hysterectomy, is really important because you have ovaries and we want to make sure that there is nothing, no tumors that are palpable. Right. There's still a vaginal area that changes can occur.
The lining,
in
actually.
The lining. Mm-hmm. And so again, it is important to still have a pelvic exam, if not every year, at least every 2 or 3 years. The pap smear is different. The pap smear is a screening test for cervical cancer. And it's actually detecting abnormal cells in the cervix. It is not the same. It's not detecting necessarily cancer before we arrive at cancer. We are basically detecting abnormal cells. And the pap smear is really composed of 2 parts. So the pap smear itself is a cytology exam, and that's looking at the cells. The other component of the pap smear exam or pap smear test is the HPV,
right,
which we recommend in women after age 30. And that's to detect the presence of the human papillomavirus, which is a virus that's associated with abnormal cells and cervical cancer.
There's a lot of false positives. I know that because it happened to me where I was like, oh my gosh, and they told me to come back, and I got very nervous. But it's common, right?
It's very common. HPV is very common. There's different types of HPV. Many women will actually fight off the infection, but as long, again, as they are routinely going to their primary care doctor, their gynecologist, and having these regular pap smear exams, especially if there is a history of an abnormal pap
Sure.
smear with even more reason, or HPV, positive HPV. Everything is, again, it's individualized as far as the frequency of the exam, whether it's every 6 months, whether it's yearly.